Symptoms of dementia, loss of memory. And we used to say it was short-term memory, and most people say it's probably predilected to short-term memory, but it also affects long-term memory. The problem is, if you're talking to a person 90 years old, you have no way of validating their long-term memory, because you weren't alive when they're telling you the story. Right? So, apparently, it may not be as different as we think. It probably affects both systems, but we just don't have the measurement tools to accurately validate the long-term memory. Okay? Impaired judgment and reasoning, and that's definitely there. Right? So, what's really interesting with dementia, with the Alzheimer's type of dementia, people lose insight. So, if you were depressed, and I said, tell me about your memory. Well, doctor, I can't remember anything. Okay, well, tell me about that. Well, I can't remember anything short-term or long-term. They know that they can't remember. If I say to a person with dementia, tell me about your memory. Well, you know, I'm 75 years old. All old people lose their memory. What are you getting on with this foolishness about? They trivialize their memory loss. Right? People with dementia trivialize. They lose their insight. Their insight gets impaired. So that's what the point I'm making up there. Changes in emotions and mood, and that's really difficult because when you get frontal lobe, frontotemporal lobe involvement, your filters, your social filters that you've learned are gone or breaking down. So you could be inappropriate. It's very fascinating when you get into the advanced stages of dementia, how the brain, it never ceases to amaze me how people with advanced dementia can read your body language. They can read it better almost than we can. Because as a child or as an infant and learning, and the brain engrams into your brain. In other words, the learning is so accentuated and the pathways are so entrenched. It's like looking at a road map of Newfoundland. And the Trans-Canada Highway is really dark red, but all the tributaries going out are little tiny black lines. And you can see, with an eraser, you can wipe out the little lines very easy. But the big red line is hard to erase. That's why those memories are ground in there. And we know that certain types of memories are are very heavily ingrained. And it's my opinion, this is just me speaking now, because I deal a lot with people with advanced dementia and their work on, is that they beautifully exemplify how they read nonverbal communication. Because the baby has to read nonverbal communication. Now, I'm not infantilizing older people here. I'm just saying that when your brain is developing, and before you get your speech language developed, you have to use your eyes and you're looking at visual stimuli. People with dementia, if you walk into a room on an advanced dementia ward and you're angry, and you walk and sit at that table and you're angry, you don't have to open your mouth. Everybody around that table will be angry. Because they're reading your body language better than you can read it. So when we're caregiving for people with dementia, it's very, very important that we bring in our best deck of cards of showing that we're calm, that we're interested in them, and they perceive that we're gentle. Because if we come in and we're abrupt, and we're loud, and we're aggressive, guess what we're going to get back? Abruptness, loudness, and aggressiveness. So one of the very important things for caregivers of people with dementia is to realize themselves how they react. Sometimes you got to look at yourself in the mirror and you scare yourself. The nurses, I tend to be a type A person, so when some of the patients on the floor get, one of the nurses will take me aside and settle down here today, and I know exactly what she needs. And I do that, and she saves me from having to get into setting a patient up. And we know with staff, so now I've learned to control my own behavior. And when you're caring for people with dementia, you have to do that. You have to learn about yourself. You have to learn about the things that people do that relax them. That's usually procedural things you do with your hands. So because this procedural memory is the last to go, one of the last in the brain to go. So that procedural memory will stay intact right up often into the very advanced stage of dementia. So guess what? When we distract people with dementia, we go to a procedural skill they had all their lives. So if they were a carpenter, you might start giving them a bit of this piece of wood and some tie bricks or whatnot, and say, hey, go working like that and you're fine. Distracts them, gets their brain into a good place. Right? The reason why their brain is in a bad place is because they're getting information and they can't process it. So if you get into they have say you left Newfoundland, and you went down into the biggest mall in the States, you're never in it, you come in here, so you come out, oh, shucks, I'm befuddled. I can't stand all this processing going around me. Imagine if you're like that day when you wake up in the morning, and your eyes open, and you're in that mall. For a person with dementia, it must be like that, because their computer, their central computer, the RAM in that computer, the recent memory access is so distorted that it takes very little to throw them off. So we have to be very perceptive to those things. Changes in behavior, changes in physical abilities. So in the behavior we talked about, and changes in physical abilities. People will tend to become withdrawn. One of the things that's most difficult with dementias is the apathy and loss of interest. They're almost like they're depressed. And in fact, they probably are depressed, which raises an interesting feature. Do they know? Do at some level of consciousness, do they know? Do they know? Right? But this is a real problem, because we know that in terms of physical exercise, one of the things that's really important to preserve neural function is physical exercise. And resistance-based exercises are really good. So if you're using a push bike or walking with those little weights on and doing your stretching and doing your walking, the better functional state you're in physically, the better you will be in your mood state with your dementia, and the better you will be for the caregiver. So it's important for the caregiver to take care of their health, and it's equally important for the caregiver to optimize the health of the one they're caring for. So, okay, questions online? We're good. Okay, duration of dementia. Look at this. 3 to 20 years. That's amazing. We think that people with dementia probably have the disease between 7 and 10 years before we can even identify it. Right? Average age is between 8 to 10 years from the diagnosis to when the disease will it's a chronic disease. Progression often described in stages, mild, moderate, severe, and there's several staging systems, and we'll talk about some of the more relevant ones. But just imagine, we got a 20-year disease here. So the good thing about a 20-year disease is it gives us time to plan. And if we know the progression of that particular disease, we can look at the pivotal points in planning that the caregiver is going to need support. Right? Makes sense, doesn't it? So early on in the disease, we can incorporate the person with the disease into the discussion. That's why the Alzheimer's Society wants to see dementia diagnosed as early as possible, so that we can include the person who's suffering from the dementia into the decision-making processes. We want to know how they want to be treated. That's important. So whereas if I diagnose somebody late, then I'm relying on the caregiver's opinion, which may or may not be accurate for what the person would have wanted. So it's difficult, but we try our best. And it never ceases to amaze me how much I learn from my patients and from the caregivers. If you listen, you learn. If you watch and observe, you learn. And there's a lot I've learned about how the brain works from looking at people with dementia. It's been a real privilege in my practice. I look at it as a privilege. And there's very little you have to do for a caregiver to boost their energy, to keep them in that caregiving mode and get them over that hump that they're faced with. It may be just a little bit of advice on behavior that's killing them that day. It may be a little bit of empathy to let them know there's another soul in the world that understands what you're going through. And then trying to get a little bit of help in to break that pressure, the pressure cooker they're on. In Newfoundland is an interesting phenomenon. You'll find some people present really, really late with dementia. You say, how could somebody with advanced dementia be presented for the first time to my office? How could that happen? And what happens is, the spouse
take care of it all.
Takes care of everything, right? And they compress their social circuit as the spouse feels the person can no longer cope. The circle of friends collapses. They get narrower and narrower to the point it's just him and her. Mm-hmm. And then when wandering comes in and confusion at night comes in, there's no way you can sleep. It's just, it's absolutely torture at that point. So if we can get to the person early, get the support systems in place, have the family share in this whole thing, maybe we can prolong the person in their homes longer. And if we can maintain, I'm totally convinced that the longer we can maintain people in their homes in a familiar environment and in familiar surroundings, the better off they're going to be. So I had a case recently that went out to a rural Newfoundland, went back to rural Newfoundland. They were going to move into St. John's when the spouse was diagnosed with dementia. And the wife came in, or his husband came in and talked to me about it. And she said, what do you think of this now? Or he said, what do you think of this? We're going to move back to this rural remote community. I said, brilliant. And the reason why it's brilliant is in the rural community, everybody knows you. Everybody looks out to you. You're mobile. You're not stuck in the house. You're not trapped in the house. You can go out. You can get a friend to walk you down the lane and walk you up the lane. You keep physically active. You're engaged. All the things we know that preserve brain function. Healthy body, healthy mind. Just because you got dementia doesn't mean we shouldn't still focus in those areas. Okay? So that's important. Questions? Questions in the audience? Okay. Alzheimer's disease. This is progressive, degenerative, irreversible disease that affects the brain. It results in impaired memory, thinking, and behavior. It is not a normal part of aging. The most common form of dementia accounting for about 65% of all dementia cases. So we mentioned those points. The 4 cardinal symptoms of Alzheimer's disease: loss of executive function. So when you first get it, and we can recognize it, you're starting to lose your very high order planning activities. So if you are a master baker, most females, and this is a very male-centered discussion point here now, most females in the older generation were great cooks. But in order to be a great cook, you have to know the ingredients to put in. Now when you're getting early dementias, sometimes that recipe gets shagged. And the person who's eating the meal will notice that that turkey wasn't quite right. That's executive function. That's the first sign that happens. Okay? And that's hard to pick up on. As somebody who knows you really well, who's working side by side with you, day in and day out, and they pick up on those little quirks. Short-term memory seems to be more adversely affected. Visual spatial function gets affected. And where do you think you're going to pick up on visual spatial functioning getting affected? Right, on the highway, at intersections. Because there's complex decision making, and these people stop at green lights. They ease themselves through the intersection. They have problems where the most complex driving situation is, which is at intersections. They have problems. And when they go in the city, they'll avoid parts of the city because they know they get confused in those places. And that's a sign they could be having problems.
So they are aware.
They are aware. But how aware is the question?
Yeah.
Because they will still drive their car, and that's the hardest thing. One of the hardest things I have to do in my treatment of patients with dementia is to say to them, I'm going to have to refer you to motor vehicles for a driving assessment. And they feel that's betrayal.
Yeah.
And I don't want to lose the patient because I may be their major link with that caregiver to keep them in their home longer. That's really important. And then the fourth part of the Alzheimer's syndrome is speech compression. They tend to use simpler words over time. Okay? And we'll see that thing progress. Okay? So, questions? Anybody have any questions on it at this point? Are we okay?